I do want to open this up to anybody who has any kind of questions. I did want to say a couple of things first, however. We want to thank, there's two foundations that actually have been the bulwark of this Eldercare Workforce Alliance, and that is the Hartford Foundation and Atlantic Philanthropies. They had the foresight to actually support the coming together of these 28 groups, and those groups have continued to come together and have been sustained in large part because of those investments. And I think the investment on the private side and the investment on the public side is what's going to make this happen in the long run. The second thing is that we actually have a couple of asks for all of you who are from the congressional side. The first is that the Boxer bill is being introduced tomorrow. This is Caring for an Aging America. Senators Cole and Collins will be co-sponsors, and we are asking members to sign on as co-sponsors. So any of you who actually have gotten all of the different disparate pieces of what needs to be put together around creating this workforce, please go back and think about co-sponsoring that bill. The second is to look at the Title VII and Title VIII appropriations requests. They're in your packet, but we need members to support this funding because it's not enough to have the language around what we need. We have to have the money to actually make it happen. So those two asks are really short term. In the long term, I think it's really important for you to understand that this is an ongoing systemic battle. If you think about all of the things that your members have looked at, invested in, for example, around health care reform, that was one piece. The legislation is just the beginning. The actual making of these programs require this workforce. And if I can leave you with one message, as I said before, this isn't a magic response. It happens because of people. Right now, we have a workforce that is woefully underprepared to address the needs of probably the most historic demographic phenomenon in the history of the world. The aging of the population is a fabulous achievement, but it comes with a lot of requirements. Those requirements will not be solved through magic or through even some technological innovation. They will be solved through people, hands-on and administratively addressing these needs. You heard a lot about what the team means, everything from nurse delegation to working around the front line to making sure all of the professions are trained. And I love the sports analogy because that's really what a team is all about. And quite frankly, if we in the U.S. invested as much in our workforce as we invest in some of these sports teams, maybe we would be in a better place. So I think with that, I don't know how many of you have questions, comments, thoughts on how you might affect this kind of a change. Going to open it up, and don't be afraid to raise your hand or make a comment or whatever. Anybody have any? Sure, Ann.
I would like to ask a question about the geriatric social worker situation and whether they are generally working in aging disability resource centers or not, and also in the hospital discharge planning process. It seems as though they would be well placed there, but I don't know if that's common or unusual.
And if anybody can hear the question, it has to do with the sort of the role of the social worker in a lot of these transitional care and the Aging and Disability Resource Center activities.
Wonderful question, Ann. Two things. Social workers were the mainstay of discharge planning at one time. They're much less so in many hospital environments. I think with the push of DRGs and the need for length of stays to be shorter, the focus has often been on a utilization management approach. And some hospitals have put nurses in those roles, who I'm sure do very well, but the social workers maybe as a result have been depleted in those roles, and sometimes the psychosocial aspects of the care or the going home process are missed as a result. That, and in terms of ADRCs, Aging and Disability Resource Centers, I think you're asking a perfect question, and I think in terms of the reauthorization of the Older Americans Act or the ADRCs when they come up, I think it's so important that we talk about a qualified workforce within the context of that, because there are many people in the aging network who are doing wonderful things but don't necessarily have a discipline to fall back on in terms of some of the skill sets of nursing and social work or some of the other things that could be helpful in that role to navigate those complexity of the aging. The aging system itself is hard enough to navigate, but the disability system on top of that is a really tough one. So thank you.
Anybody else? Okay, yes?
Actually, for Robin, it's for you also. You mentioned that only 38 states and only 45% of programs overall offer a specialty for education for aging adults. Is that more of a demand thing in terms of lack of incentives for that job, or you mentioned the stigma, or is it more supply on lack of faculty?
I think it's all of the above. And again, the Hartford Foundation has done a wonderful job along with physicians, incentivizing physicians and then nurses and now social workers to go into geriatrics. But I think it's still a bias, and it's a practical. When you look at people in social work, you know, their biggest interest is that they want to work with kids and they want to help kids, and that's wonderful. We need them to be helping kids, but we also need them to be helping older adults, and I think it's that stigma. I think it's, again, not having a few solid scholars within their academic settings that are the Pied Pipers of aging, as I call it. So I think it's a combination of factors. And then I also do think when they look at the dollars and cents of what they're paying to go to social work school and then what they're going to make on the, you know, if they get a job on the outside end, they're making less in the geriatric aspect of things. So I think it's a combination. But what is an important statistic that I missed in that NASW study done way back in 2006 now, there were only 9% of people working with older, that's called themselves as specializing with older adults, but 75% of those people in that study were indeed working with older adults somehow, but they weren't even identifying themselves as kind of connected to that, because maybe there still is that stigma that we have to get over of it's okay to work with this population, it's exciting, it's invigorating, you can make changes, you can make a difference, and we just have to keep that campaign going.
I guess we should close. I will leave you with this message for any of you who have kids. Would you want somebody who is not a pediatrician caring for your children? It really is the same issue. Do we want people who are providing care to our people who tend to be most vulnerable, highest need, having no training in how to care for them? That's really the fundamental question, I think. And just leave you with those thoughts in terms of all the work that you do, where you can make a difference in terms of affecting this workforce. You have a number of inroads, Title VII, Title VIII, the appropriations around loan forgiveness to help put in those incentives for people to go into these positions, because as we get more folks in, we create a groundswell of support. And without that, we're not going to be able to have at least a base for the future. So thank you very much.